Hello everyone, this is Professor Yamini Bhushan Tripathi, former Dean Faculty of Ayurveda, Institute of Medical Sciences, Banaras University. I am interacting with all of you under a 12-week certificate course on palliative care with integrative approach, which has been launched by Department of Cardiology, Institute of Medical Sciences, Banaras University, and Dr. Shwes Tripathi is the program coordinator of this whole certificate course. So today I am going to discuss about the naturopathy in the management of palliative care. Up to now we have discussed the conventional medicine, we have discussed the Ayurveda. Under Ayurveda we have discussed the Panchkarma, yoga, everything, all aspects. But naturopathy has been left because it is a non-pharmacological method of treatment. Mostly only diet and lifestyle is emphasized in naturopathy. No medicine is given. In Ayurveda, medicine is given. In allopathy, medicine is given. But in naturopathy, no medicine is given. So this is a different part, but very effective. Now, some science has also been done. A lot of research has not been published, but the people are using it and they are getting clinical benefit. How it is acting, we don't know. But still, I thought to introduce one class to all of you. So naturopathy, as you know, it focuses on the improving the quality of life. It is reducing the pain. It alleviating the side effect of the conventional medicine, like chemotherapy and radiation in cancer patients, other life-limiting illness like advanced organ failure or neurodegenerative conditions, Parkinson's disease or MS disease. So neuropathy does not claim to cure the disease. Keep in mind, naturopathy is not to treat the disease. They never claim it. So one should not misunderstand. It only supports the body's healing mechanism, which indirectly enhances the comfort of the patient. Indirectly enhances. How it is indirectly affecting, that is the science which we don't know, but clinical effect we have found, which is the main objective of the therapeutic care. So naturopathy often practiced in institutions like SDM Naturopathy Hospital, BNN College, Bangalore, National Institute of Naturopathy, Pune, Modi Naturopathy Center, Gorakhpur, Yamini Innovations Wellness Center in Varanasi. There may be many more. Now, I have given you a list of where the naturopathy is being clinically practiced. Patients are going there and getting benefit of the naturopathy. So I'm summarizing here what is naturopathy, physical and sensory therapies like hydrotherapy, massage therapy, aromatherapy, acupressure, yoga and pranayama, breathing therapy, and meditation and mindfulness. These are the therapies which are covered under naturopathy. What it does, the hydrotherapy reduces the pain and fatigue, improves the circulation, builds the blood circulation in the body, and promotes sleep. Sleep quality is improved. Massage therapy alleviates tension and anxiety. It enhances the emotional comfort. Aromatherapy also reduces the nausea, anxiety, depression, and promotes the restful sleep. Acupressure, with some pressure points in the body, they relieve the pain, nausea, and fatigue. They improve the gastrointestinal symptoms also, like diarrhea, dysentery, constipation, hyperacidity. These things also are addressed by acupressure. Yoga and pranayama, everybody knows, it reduces the stress, enhances the respiratory function, and promotes the emotional peace. And meditation builds emotional resilience, improves pain tolerance, reduces the external distress. Naturopathy also covers the biochemical and lifestyle therapies like the herbal medicine. Herbal medicine means as a decoction, some food supplement made up of spices and all. Nutritional therapy, homeopathy, and counseling and lifestyle. These things are not done by a naturopath, but an expert of these subjects can join hands in a naturopathy center to give these therapies if the patient wants. Otherwise, basically it is not a naturopathy. Homeopathy is a different science altogether, not covered under naturopathy. I have included here because sometimes naturopathy centers invite these specialists to come and join. So herbal medicines support immunity, reduces nausea, and promotes sleep. Nutritional therapy boosts energy, manages GI issues, reduces the inflammation. Homeopathy, gentle symptom relief, helpful for anxiety, insomnia, and grief. Counseling and life is a support enhances the psychological comfort, supports the caregiver and decision making. So primary benefits of naturopathy in palliative care. Now, these are the therapies: mud therapy, pain relief, detoxification. Kapda lapet, the whole body, wet cloth is wrapped on your body and you covered with the blanket. So this fever control, emotional calming of your mind. Water immersion, this is a hot water bath. Your patient is put inside for 40 to 50 minutes, and this kind of also your nervous system balance and pain reduction. Water immersion, water temperature can vary from 30 to 40 degrees centigrade depending on the tolerance of the patient. So colon cleaning. Colon cleaning is a different type of cleaning where the relief from the constipation and abdominal bloating can be obtained. Basti, any medicated enema is the vata controls and bowel regularity. Some medicated decoction is given from your anal root and which helps in removing the stool, and also some medicines which are present in the get absorbed and go to the system. So Basti is also important. And chromotherapy, the light therapy, is a mood and mental state balancing. And heliotherapy is vitamin D and mood elevation. They are some therapies and their benefits. Physical and detox therapies, I told you, mud therapy, kapla lapet, water immersion, colon hydrotherapy, and Basti, herbal enema. So all these things I have discussed in the earlier slide. I'm not going to repeat again. So chromotherapy balances emotions, calm anxiety, improve mood and using color. Sun bath, heliotherapy, boosts vitamin D synthesis, uplift mood and supports immunity. Fasting is also important. Intermittent fasting, long-term fasting, 12-hour fasting, one-day fasting. Water, only on fruit juice, only on fruits. Different kind of fastings have been described here. This promotes the body detoxification, mental clarity, and digestive rest. These are the things. So water-based therapy, and there are specifically given in naturopathy, that is a balanotherapy, spa bath, underwater exercise, and Epsom salt foot bath. There are three therapies are given. In the balanotherapy, mineral water means Epsom salts are used, rock salts are used in the water, warm water, and the patient is immersed in the tub, water tub. It reduces the pain, it improves the mood, it improves the sleep quality, and alleviates the depression in elderly. This paper has been published in the PubMed referred journal. PubMed is the site where the scientifically validated, peer-reviewed papers are published. They are listed here. This spa bath has been also significantly decreases the pain and anxiety and enhances well-being and palliative care in patients. This is also published data. Underwater exercise means aquatic therapy. You are allowed to be in the water and do physical activity. That kind of physical activity, because of the water buoyancy, it helps you to do exercise. In the air, you cannot do because of the gravitational force, and you are weak, or you are under fatigue, so you are not able to do like that. But if you go in the water and you are doing the same exercise, the effort is less because the buoyancy force of the water helps you to lift your leg and then put it down. In this way, exercise is done with comfort, better comfort than water and then air. So this is very effective method, alleviates the cancer-related fatigue. Fatigue is controlled, enhances the muscle strength, and improves the quality of life in breast cancer survivor. This study has been done in breast cancer, but in other chronic diseases also, the underwater exercise can be very effective too in bringing back the strength of the muscle and removing the fatigue. And Epsom salt foot bath, this delays the onset of and alleviates symptoms of chemotherapy, introduced peripheral neuropathy, improves quality of life in cancer. Foot bath means only your foot is put in hot water having Epsom salt. Here, balneotherapy, whole body is underwater with Epsom salt and rock salt. And here only Epsom salt. Epsom salt is a magnesium salt. So magnesium salt already have a neurological importance, neuro control. So that's why the neurotherapy and insomnia and sleep quality, everything is controlled by using Epsom salt bath. So movement and sensory therapies. These are the deep water running, aquatic exercise in postmenopausal women. Two studies have been done. That's why I have quoted it here. It decreases the cancer-related fatigue and enhances the general health and quality of life in breast cancer survivor, as published in the PubMed referred journal. And here, aquatic exercise, deep water running. This is the aquatic exercise in post-menopausal. It improves the lower and upper limb strength, agility and flexibility, and overall quality of life. So this is the scientifically validated benefits of naturopathy. Mostly the mud therapy and aquatic therapy have been studied in this. So bathing in the end of the life, this is also study have been done, does not shorten the survival in advanced cancer patients, may enhance the comfort and dignity of in final days. I don't know how far it is true, but end of the life, the patient is immovable. He is not willing to do anything. But putting them in the hydrotherapy like bathing, the scientific study has done, it improves the quality of life. We can try in our patients. If there is facility nearby and the patient can go, then we can try. Otherwise, it's difficult because in the house, it is not possible. In the hospice centers or in the palliative care center, the patient is admitted, these things can be done, not in the house. So, balneotherapy combined with the physical therapy, more effective than physical therapy alone in reducing the pain and fatigue and improving the sleepiness in elderly patients with knee osteoarthritis. This is a very effective method of treatment. Now I am going to talk about naturopathy and palliative care, body-based therapies. I have told you in the beginning, mud therapy reduces the pain and inflammation. Detoxification by mud therapy is widely claimed by naturopathy people. It calms the nervous system. Kapla Lapet reduces the fever, colon. I have talked to you earlier slide. The additional therapies in naturopathy includes bathing in the end of the life and balneotherapy combined with the physical therapy. Bathing in end of the life, it is claimed in a NCBI published journal, that does not shorten the survival in advanced cancer patients, but it may enhance the comfort and dignity of in the final days. And the balneotherapy combined with physical therapy, more effective pain than physical therapy alone in reducing pain and fatigue and improving sleeplessness in elderly patients with knee osteoarthritis. So these are the therapies which have been found effective in the clinical experiments as published public data, but a lot of work has to be done in these cases. The next slide is the naturopathy and palliative care, mind, body, and nutritional therapy. So naturopathic therapy, yoga and pranayam, meditation and mindfulness, herbal medicine, nutritional therapy, and modified fasting. These are the main methods. In addition, what I have talked in the earlier slide, yoga enhances and relaxation and improves the respiratory function. Meditation and mindfulness, it reduces the stress, promotes emotional peace. Herbal medicine relieves symptoms like nausea, insomnia, and inflammation. Nutritional therapy supports immunity, manages digestive issues, and also improves the fatigue and improves the fatigue symptoms are reduced, and the body strength and stamina is enhanced by proper nutritional intake and nutritional absorption. And modified fasting is a kind of detoxification. It promotes body detoxification and digestive rest under supervision of a Ayurvedic doctor or a yoga practitioner. So these are the things which you can do. I'm summarizing it now. The integrative approach versus standard protocol in palliative care. Philosophy of a standard protocol of palliative care, an integrative approach in palliative care, and how integrative approach covers limitations. What are the limitations of standard protocol and how it is covered by this? So philosophy is focus primarily on symptom control and quality of life using a standard medical intervention. Integrative approach incorporates physical, emotional, social, and spiritual well-being through complementary therapies. So addresses the multi-dimensional nature of suffering. Integrative approach as a supportive medicine to conventional medicine, it addresses the multi-dimensional nature of suffering, especially non-physical aspect. Modalities used here are the opiates, non-steroidal anti-inflammatory drugs, antidepressants, psychological counseling, radiation and chemotherapy for symptom relief. They are the modern medicine. In Ayurveda, we are adding yoga, meditation, Ayurvedic acupuncture, music therapy, panchkarma therapy, massage, nutrition and spiritual support. By combining these with these, you can get enhance the pain and symptom management with fewer side effects. It supports the emotional resilience. Pain management is very important. Relies heavily on relies heavily on pharmacological means like opioid drugs, narcotic drugs, morphine-like drugs. Here we combine the pharmacological with non-pharmacological methods like mind-body technique and acupressure. These things are there. It reduces the drug dependency. If we are using this in combination with this, the drug dependency will be reduced, drug dose will be reduced, drug dependency and side effects will be reduced. May improve the pain threshold. So this is a combining effect as an additional effect. Emotional and psychological care. In modern medicine, we do psychological counseling and psychiatric medications. In Ayurveda, we include art therapy, music therapy, guided imagery, mindfulness, naturopathy, nature therapy, and panchkarma therapy. So by combining these two, you can get more individualized holistic emotional care of your patient. Emotional therapy and a spiritual care often limited in chaplain services here. But here we involve meditation, rituals, depending on their family, connections with nature, culture rituals, and meaning-centered therapy. These are the complementary medicine tools. So better aligned with diverse cultural and spiritual needs of your patient. And patient-centered, limited customization. It is a generalized method, generalized protocol, which applies to everybody. But in a complementary medicine, it is not general, it is person-specific depending on his genetic constitution like Vata, Pitta, and Kapha, age, his likeness. So highly personalized care plan based on patient's value, preference, and belief. These things are taken care in integrative approach. By combining these two, enhance the dignity, autonomy, and sense of control. The family members as the first line of caregiver, importance of support. The challenges faced by the family caregiver. These are the challenges and consequences. Emotional stress and burnout, number one. Depression, anxiety, feeling overwhelmed. They have physical fatigue, weakness, health issues, neglect of self-care because they are busy in their patient care, they are neglecting their health. Lack of training, they are not well trained. Difficulty in handling patient symptoms and increased errors. And the financial pressure, debt, reduced earning capacity, inability to sustain palliative care in the old, chronically ill patients in the family. Social isolation. They are always busy with the patient, not going outside to meet their friends and relatives. So withdrawal from the community. This is a side effect. Relationship is strained. If you are not going to somebody's house, why they will come to your house? But because you are not going because you are physically and mentally involved in your patient care day and night. This is the cause. But your friend does not appreciate it. He wants you to come, but you are not going. The social isolation, withdrawal from community is the side effect. Grief and anticipatory loss, emotional trauma, unresolved feeling after patient death, that is also important. A communication gap with healthcare providers, confusion about the treatment, lack of involvement in decision. So these are the some consequences of the family who is the first line of caregiver to the patient. So these are the issues and these are the consequences. So why caregiver support matters? So we have to support the caregiver also, not only the patient, because it will reduce the caregiver burnout, number one, which improves the quality of care for the patient. If the patient caregiver is good, patient service will be also better. It ensures the sustainable caregiving by improving mental and emotional and physical resilience. And it helps to build a collaborative care environment between family and the healthcare team. That collaborative care environment will be established if the family is under stress, the family is not under burnout. So be careful while treating the patient. You should also take care of the family trauma, family stress. You should discuss it openly. And what are the limitations of the family in giving the services to his patient? If you know, you can manage accordingly. The take-home message is don't focus only on patient. Focus on patient as well as the family, which is first line of caregiver. With these words, I end my talk. Thank you very much.